and thank you so much for coming out here today. My name is SONIA BOEGER, and I am a senior at South Salem Highschool. I would personally like to thank the Salem chapter of Democratic Socialists of America, Healthcare for All of Oregon, and Mid-Valley Healthcare Associates for spreading the word and helping contribute to this event. I would also like to give a special shout out to Larry McCool, Ariel Knox, and the famous Caesar the No Drama Llama. I would also like to thank our awesome volunteers for helping organize and set up this whole setup today. Okay. So this event was organized by my incredible colleagues and I from South Salem High School's Progressive Activism Club. We founded this club this year to give youth a voice and empower them. A Medicare for All policy is something that many of us feel strongly about because a loved one or ourselves has struggled with paying for medical checkups or procedures. Personally, this issue is important to me because I have had 5 leg surgeries and 1 neck surgery to treat my rare bone condition, X-linked hypophosphatemia. Going through that was emotionally straining on me as a child. However, I've been fortunate enough to receive care through my health insurance and the non-profit organization Shriners and Doernbecher's Children's Hospital. I cannot begin to imagine what it would be like to not be able to have these surgeries that have effectively made me an able-bodied person. Without further ado, I would like to introduce our first speaker, Deb Patterson. Deb Patterson has more than 20 years of experience in health advocacy and education. She was a team leader of the Deaconess Incarnate Road Healthcare System.
Come a long way. The days when a hospital stay for a week required you to put down a $5 deposit. At the end of the week, you'd get back what hadn't been spent out of the $5 bill. We've come a long day from when nuns in Wisconsin helped loggers by offering one of the first group plans to pay for the care of those who are sick or hurt. Those socialist nuns. We've come a long way from when hospitals were houses supported by church ladies who made soup and sewed curtains. When there was no antibiotic-resistant bacteria because there weren't any antibiotics. When ether was your anesthesia, and most surgeries were amputations. We've come a long way from World War II when employers couldn't give raises, so they offered something called health insurance as a benefit to keep workers. Today we have IVs, CTs, MRIs, and an alphabet soup of medical advances. We have skyrocketing costs with the health insurance industry making a fortune off us. 18% of our GDP is spent on health care, more than any other nation. What do we get for that spending? We have the lowest life expectancy and the highest infant mortality among the top 10 high-income nations. Friends, as a retired healthcare administrator, I'm here to tell you that this is fiscally irresponsible and unacceptable, which you already knew. And as a clergy woman, I'm here to tell you, and you already know this too, that this is morally unacceptable as well. Our costs, by the way, Jesus said, preach, teach, and heal in my faith tradition, not preach, teach, and steal. Our costs keep going up. We can't afford to pay more. According to a Federal Reserve 2017 economic report, nearly half of Americans have less than $400 in savings. Medical debt contributes to 2/3 of all bankruptcies in this country still today. A study published in the American Journal of Public Health estimates that for the nearly 30 million uninsured individuals in the U.S., lack of coverage leads to nearly $4 leads to about 45,000 deaths every year. That's the equivalent to the death toll on 9/11, nearly 10 times over every year. Today, many small businesses can't afford to provide health insurance. Larger employers can provide it, but some plans lack important benefits such as cancer care. It's time to untangle health insurance from employment, which is exactly what happens when you retire and you go on Medicare. It's time to be fiscally responsible, providing comprehensive quality health care for all, at less cost. Medicare for all is a way to get there that has growing support. To be sure, there are other ways. The German model of regulating health insurance companies, which are non-profit organizations there, and heaven help us if we don't just focus on the goal. If we don't, we'll be set up to fight among ourselves and shoot at each other in a circle and end up with nothing more than we have today. In this, I agree with Dr. Andrew Shute, who is not the biggest fan of Medicare for all, but who says, morally, it's a great failure that lack of insurance coverage and high prices restrict so many Americans' access to health care. Medicare for all, he says, brings equity to the system through universal coverage and the elimination of medical bankruptcy. Let's fight for universal access to health care through shared public cost. Let's invest in our economy in ways that are savvy and sustainable. When we uncouple health insurance from employment, employers can raise wages, industries can be more competitive internationally when they don't have to shoulder the burden for health insurance. Some say we can't change because it'll impact jobs. But why should such a large percentage of my health care premiums and yours, about 20%, be used to pay for jobs that provide no health care services?
I'm Mike Huntington, a retired cancer doctor from Corvallis. Thank you for letting your passion and your foresight lead you to this gathering today. Probably each one of us here has a compelling story of why America and Oregon need universal health care. Health care for all, everybody in, nobody out. Here's my story. I was a radiation oncologist for 35 years and worked for 22 years at the Cancer Center in Corvallis. I began seeing increasing numbers of patients coming to us, sometimes in crisis, through the emergency room with advanced cancers. This didn't make sense because we were getting better at diagnosing cancer earlier. No, these patients waited and waited because even though they were afraid of serious illness they might have, they were even more afraid of medical costs that might make them lose their savings or even their homes. Each time this happened, it made me feel sick and upset that could happen in this country, the wealthiest nation in the world. After I retired, I heard from a nurse at the Cancer Center about a conversation she heard in an exam room. A middle-aged man was talking with his wife. He said, "Honey, they tell me I have stage 3 lung cancer and that I need chemotherapy and radiation therapy." A psychiatrist I knew told the story of a patient whose husband was a roofer. One day he fell while on the job. The only thought in his mind as he fell was, "I hope this kills me." Because of tragic stories like those I just mentioned, the national momentum for universal health care has been building over the past 3 years. The Affordable Care Act helped people get Medicaid, but did not control costs or make it easier for most of us to get the care we need. What can you do? On February 27th this year, House Resolution 1384, Medicare Act for All of 2019, was introduced by Representative Camilla Jayapal of Washington State. It has 108 co-sponsors, but it needs more key sponsors. Representative Kurt Schrader is one person we can influence in our area who is on the important Energy and Commerce Committee, which must hear this bill if it is to reach the floor. Representative Schrader is one of 2 of our 5 representatives who have not yet signed on to the Medicare for All bill. You can make this happen. Representative Schrader's office is just a few blocks from here at 530 Center Street Northeast. I believe he will be back home here on recess between April 15th and the 28th. Make appointments to talk with him and his aides. There are other things you can do. Join with other healthcare activists right here in Salem. Go to healthcareforalloregon.org, HCAO.org. Go up to people wearing red t-shirts with Healthcare for All Oregon on them. Exchange contact information with them so you can stay in touch. Oregon is considering its own plan for universal health care. It is Senate Bill 770, which has been approved by the Senate Health Care Committee and has been referred to the Ways and Means Committee. Your voice needs to be heard by senators and representatives. You can be sure they are already hearing from opponents who will profit from and do not feel the cruelty of our current system. This is a glorious marathon, not a 50-yard sprint. Nurture your passion, rehearse your stories about our cruel healthcare system, and tell them often to others, and gather their stories. Phone, write, email, visit your federal and state legislatures. Make healthcare for all a reality.
I would like to welcome KC, a local activist for the Salem chapter of the Democratic Socialists of America.
Good afternoon, everybody. Thank you for braving the weather to come out here. Thank you. Thank you very much. My name is Casey. I'm an organizer with the Salem Democratic Socialists of America, and I'm here because I know that we need Medicare for all. Single-payer health care is a simple concept, really, and Medicare for all is a snappy name. People in Congress have been slapping the name Medicare for all on a lot of different bills, and most of them are crap. I do like the Jayapal bill, I do like Bernie's bill in the Senate, but the other ones use the name and they put it on top of crap. So here are the things that we must demand, no matter who is in Congress. Comprehensive coverage for all medical services and treatments, including long-term care, at all providers for all people in America, regardless of citizenship. Care that is free at the point of service with no cost sharing, and a jobs initiative and severance pay for those affected by the transition. Now, I'm here because I know that the American healthcare system is not built to improve health, but to create profit. And I have only a few minutes, so I'd like to talk instead about health justice. And I'd like to draw from the words of Tim Faust, who is a DSA member, whose work on health justice is what drives me to fight for single-payer healthcare. If people are suffering because they don't have a place to live, or if the places they live are unsafe, then housing is healthcare. And you build housing to bring healthcare costs down. If people are suffering because they don't have healthy food to eat, and they're getting diabetes or cardiac failure, then food is healthcare. And you provide them with affordable or free food options to bring healthcare costs down. If people are suffering because they don't have needle exchange programs, therapy, or counseling, then rehabilitation is healthcare. And you build addiction treatment programs to bring healthcare costs down. Single payer is not the goal, single payer is the tool. Health justice is the goal. And when we fight for health justice, we fight side by side, because economic justice is health justice. Environmental justice is health justice. Reproductive justice for people who don't want to reproduce and for people who do is health justice. And justice for black lives, justice for brown lives, justice for trans lives, justice for the lives of immigrants, justice for people in prison, and the well-being of all people, regardless of age, gender, race, or creed, is health justice. Our health is tied to enormous systems like structural poverty and colonialism And these types of problems are fundamentally tied to capitalism, a system that relies on the oppression and exploitation of billions of people so that a few people can live in luxury. When we fight for health justice, we fight against capitalism. And capitalism is already waging a war against us. Every time the insiders, the well-meaning people in Congress, the well-meaning union or nonprofit leaders have taken on the insurance industry, they've lost. They lost in the 40s, they lost in the 60s, they lost in the 70s, they lost a few times in the 90s, they lost in the 2000s. Right now, as was mentioned before, Kurt Schrader is not even one of those well-meaning politicians. He thinks that Medicare for all is not practical. But, yeah, exactly. But when the insiders lose, they still survive. The people who suffer are the people in Section 8 housing, or without any housing at all. People in prison. People who live near polluting industries. People with disabilities forced out of their homes. Poor mothers and poor children. People forced to flee their home countries only to find themselves hunted by ICE in America, not sure if they'll be deported if they go to a hospital. We feel the stakes of this fight in a way that those insiders can't. We must build a massive popular movement that demands health justice. We must identify what battles we can win and win them. We must demand and create not policy tweak incrementalism, but material relief and redistributive reforms. I don't know what the revolution looks like, but I know it will require massive mobilization, like what we saw in San Antonio to win paid sick leave, like what we saw in San Francisco to win the right for counsel for tenants facing eviction, what we saw in Idaho to win a Medicaid expansion. We build solidarity so that we can build power. Do not go home today without talking to the organizers who are here. We all have ways to help you fight for single-payer health care. 18 months ago, I was confused and scared, and I didn't know how to fight back, but then I started organizing with tens of thousands of others in GSA. We are always learning from one another and fighting on all fronts to build a better world for everyday people like you and me. Right on. We would be more than happy to get you involved, no matter how much time you have to spare, even if you're worried you don't know where to start. I didn't know where to start 18 months ago either. Friends, single payer is moral, single payer is necessary, and single payer is achievable. Solidarity now and solidarity forever.
Thank you so much, Casey. So next I would like to welcome TREVOR PHILLIPS, an emergency medicine physician in Salem, Oregon, and the Yale director.
Welcome, healthcare justice advocates. I would like to thank today's organizers and the groups that are responsible for making today's Medicare for All March a reality. I would like to thank SONIA and her fellow students for inviting me and my fellow speakers to come out today. Seeing today's youth step up gives so many of us hope in the present day and for a better tomorrow. My name is TREVOR PHILLIPS. I'm a licensed physician, board certified in emergency medicine. I have practiced medicine in the busiest emergency room in the state of Oregon for the past 10 and a half years. I have the privilege with working with a dedicated team of real-life superheroes. In the emergency department, we have the honor and responsibility of saving lives every day we go to work. But why are we all here today? Why am I here? We are here building a movement. I'd like to start by saying what I'm not here to do. I'm not here to sell you on the idea that healthcare is a human right. It's my educated guess that every person here knows that healthcare is a human right. I am not here to convince you that improved and expanded Medicare for all is the best way to guarantee that every person gets the healthcare that they need. I am not even here to tell you my story about seeing the historic changes made by the Affordable Care Act firsthand. I'm not here to tell you that lives saved and bettered by the expanded coverage and guaranteed protections made under the ACA. I'm not here to tell you about how 94% of Oregonians, including essentially 100% of kids, now have coverage. I'm not here to tell you about the ongoing sabotage of healthcare by this current administration that we're seeing federally. No, I am here to ask you for your help. We need you. You are more important than my team of healthcare superheroes. You're more important than any politician. Your collective action can save more lives. So I'd like to ask a rhetorical question. Trevor, how can I help? Great question. Here's how. Number one, be a voter. Voting is the ultimate power move. Billions of dollars have been spent over decades to make us forget that we, the voters, have the power. Research has shown that the fear of missing out of historic elections is in fact a powerful motivator. Use it. Repeat these words. Everybody votes.
Everybody votes.
Everybody votes.
Everybody votes.
Be a voter.
Be a voter.
Okay, the second most important thing to do is to make a voting plan. Repeat these words. Make a voting plan.
Make a voting plan.
Here in Oregon, we have automatic voter registration and mail-in ballots, but people still need to engage in the planning process. Visualize getting your ballot. Will you mail it? Will you use a Dropbox location that's open 24 hours a day? Make these decisions now so that there's no distractions come election time. This is ad lib. Vote early, vote often. What do I mean? Vote in every election as soon as you can. We have an election this May, an off-cycle election. Your vote matters more in these elections than in any other because it takes so few votes to make a difference. If you live here in the Salem-Keizer area, you have the option to vote for school board. Do so. Election ballots go out May 1st. They're due on May 21st. If you vote early in the cycle, you save effort and resources for the campaign and candidates. We have the opportunity to support some local progressive Latinx candidates. Please look them up and support them. Okay, number 3, contact your elected leaders. The best and most powerful thing you can do is to call your elected leader's office. Search their name on any web search engine and find their office phone number. When you call, tell them your name, tell them your zip code, tell them that you're a constituent, and demand that they support Medicare for all. We have opportunities to make a difference right now at the local level. In this country, there's a pattern of states leading the way. Be part of that change. If you need help, sign up for Healthcare for All Oregon at hcao.org. Right here on my shirt. Support the Senate Bill 770-1 to make Healthcare for All a reality here in Oregon. In the words said by my fellow speakers and earlier today, the motto of Healthcare for All Oregon is everybody in, nobody out. Say it with me. Everybody in, nobody out. Okay, fifth and final, the least important, but it's very important. A picture's worth 1,000 words. This may seem silly, but it's very important. Take pictures today. Take pictures every single time you go to things like this and share them with your friends, your family, and on social media. Use the hashtag Medicare for All and healthcare as a human right. Having your friends and family and your community members see you do these things will change hearts and minds. thank you all for being part of this movement building process and coming out today to stand up for our community members who can't do these things, that need the help and health care that we all know is a right. I would like to introduce the next speaker and final speaker for today, a friend of mine, Dr. Tony Germann. He's a primary care physician in Woodburn. He's an amazing healthcare for justice advocate and warrior. He's got a public health degree from Harvard. We met in the office of Representative Schrader when we and about a dozen other healthcare advocates asked him to support Medicare for all. Now, he has changed his position from a solid no to a he will consider. So by doing the things like making phone calls, we can keep that pressure and encouragement going. So please say hello to my friend, Dr. Tony Germann.
Good morning, everybody. Wow, what a beautiful day and some beautiful people out here. You guys are really braving it. Well, my name is Tony Germann, and I'm a local rural family doctor. But more importantly, I'm a father, I'm a taxpayer, I'm a son, and I'm a husband. It's a true delight to join you in this fight for Medicare for all. Personal health affects everyone. Health provides equity. Good health allows for opportunity. It affords our citizens the ability to work, learn, and grow. The absence of health prohibits us as a society. Workers are more productive with access to health care, and our children flourish in the classroom when we eliminate the hindrances of illness. So what is single payer? It's rather simple. Universal, comprehensive, provides security, and it affords freedom of choice for any doctor or hospital. We're here today for no small task. We see change is necessary in our nation. We are faltering. Understandably, we are searching for improved outcomes. We look to other nations and question, why can't we have what they have? Why does a woman who enters a hospital in America to deliver her baby have 5 times the risk of dying compared to entering a hospital in the UK, Germany, or Canada? Research is clear. We've seen an alarmingly lower life expectancy in this country when compared to our fellow developed nations. We should have more pride in America and demand better for our parents, partners, and children. Is Medicare for all a pipe dream? I don't believe so. Other developed nations don't believe so. We can and will eventually do this. We have the tools as a nation to accomplish this goal. People are catching on in this country that this is feasible, it's practical, and quite simply, it's the right thing to do. We just need to continue to lead our legislators to make the right decision. We need to do this not only because it is the just thing to do, but also because we are getting ripped off. We pay for all this health care, so why don't we get the outcomes we deserve? We spend $3.5 trillion on health care. Per person in this country, we spend twice as much as Canada, UK, Germany, Italy, and the list goes on. I would prefer to see some of that money go to other necessary portions of our budget, such as education. We should use those dollars more efficiently and help pay for college rather than put those dollars down the drain. We are wasting money. As a taxpayer, I want more from our dollars. I want my wife and kids to have the health seen in other nations. I want security. If someone loses their job, they should still have access to health. I want a seamless and universal healthcare system. I want a system that prioritizes health over profit. I want a system that doesn't put shareholders' benefits over medical science and justice. I want my friends that are interested in beginning a new business not to be prohibited by the fear that they will lose their health insurance. The truth of the matter, when it comes to insurance, is that people want to purchase it. They want to be responsible citizens. The fact is they can't afford it in this country. This piecemeal healthcare system has made attempts to allow people to get healthcare, but we've seen the erosion of employer-based health insurance and the continued escalation of costs. In 2017, Kaiser Family Foundation, a well-recognized health policy institute, found that 45% of uninsured adults said they remained uninsured because the cost of coverage was far too high for them to afford it. 75% of the uninsured have one working family member, and above that, 11% are at least working a part-time job. The majority of people are doing what they can to put meals on the table for their family, and we have priced them out of health care. So how do we do better? We need Medicare for all. Working as a Rory family practitioner in Oregon, I see the challenges my patients face with insurance every day. I see the difficulties presented to uninsured, and even those with insurance. Private insurance is structured to make money. This comes at the expense of affordability. Many of my patients have co-pays and deductibles that prohibit them from purchasing their meds, and they delay the care they need. 1 in 4 adults in this country reports they can't afford their medications. That's an emphasis right there. My asthma patients limit their use of necessary inhalers to control their symptoms and suffer unneeded hospitalizations. My patients with heart disease go without their blood pressure meds and suffer preventable heart attacks. My diabetes patients stretch out their insulin as the cost has risen over 300% in the last 10 years, even though it was invented almost 100 years ago. This just isn't right, or it is the result of the insurance companies making revenue on the backs of patients. We can do better. So what do we want? Medicare for all. What do we want?
Medicare for all.
How do we arrive at Medicare for all? We find success in you, the youth in this crowd, and the people in this crowd. I want everybody to find that passion and that drive you brought here today. Stand out here in the rain. Find that story of your family member, your friend, or your own personal complications with this broken healthcare system. Use that as the fire that will lead you to action. Use the tools you learned and you discussed today. Put them in motion. Vote. Make calls. Register for Healthcare for All, Oregon, and most importantly, learn about the facts of this healthcare system. Political battles are slow and arduous. Do not happen overnight. I encourage all of you to stay committed to this fight. It's more important than us individually, and is measured in the currency of people's lives. Let's not let one more person suffer the fate of preventable illness or the loss of their life just because we don't have a broken healthcare in this country. We can do better. We need to demand a single-payer Medicare for all. Thank you all for your time, and I thank the organizers of this event